Hello, so this is Concepts of Chemical Dependency, Chapter 8, Use and Misuse of Central Nervous System Stimulants. Historical evidence suggests that ancient cultures have been using CNS stimulants for thousands of years before modern science knew of the chemistry of these substances. To understand CNS stimulants requires an exploration of two different topics: medical uses of CNS stimulants, including effects, side effects, and complications from CNS stimulants misuse. CNS stimulants as used in medical practice, 1 of 10. Ephedrine was isolated from ephedrine plant in 130 years ago. Ephedrine, used in the treatment of myasthenia gravis, as well as asthma, in addition to respiratory problems due to bronchitis, emphysema, and COPD. Potent vasoconstrictor used to limit blood loss in delicate tissues. Pharmacology of ephedrine. Primary effects are strongest in the peripheral regions rather than the central nervous system. Blocked reuptake of norepinephrine, or NE, I'm just going to say NE, tolerance to bronchodilation develops quickly, so its use for treatment of asthma should be brief. Side effects of ephedrine at normal dosage levels. Therapeutic index is small. Users are 200 to 300% more likely to experience autonomic nervous system problems, upper GI irritation, and heart palpitations. Some side effects include anxiety, feeling of apprehension, insomnia, and urinary retention. Those taking SSRIs should avoid ephedrine due to the potential to enhance its stimulatory effects. History of amphetamines. Discovered as artificial substitute for ephedrine, marketed as benzedrine, and was administered through inhalation. Users quickly learned how to circumvent the containers and administered intravenously. In World War II, used by both sides to allow soldiers to fight longer, could lead to a variety of dangerous, even fatal side effects. Medical uses of amphetamines. Improve the action of the smooth muscle of the body, potential for improving athletic performance. Research finds can also decrease athletic performance, has an anorexic side effect, and in the 1960s and 1970s prescribed for patients who wanted to lose weight. May be occasionally used as an adjacent to the treatment of depression. Currently only approved to treat narcolepsy, but there are several off-label uses. Pharmacology of amphetamines. Rapidly crosses the blood-brain barrier, and a single oral dose results in peak plasma levels in 1 to 3 hours. Appears to alter dopamine, glutamine, and norepinephrine transmitters. Under normal conditions, 45 to 70% of the single dose of methamphetamine is excreted by the body unchanged within 24 hours. Steady use of amphetamine will result in an incomplete state of neuroadaptation. Methylphenidate, controversial pharmacological agent introduced in the 1950s as a safer alternative to amphetamines. Prescribed for children with attention deficit hyperactivity disorder, ADHD. Strong opinion both for and against for the use of Methylphenidate for ADHD. Is sometimes used to treat narcolepsy or as an adjunct for treatment of depression. Side effects of Methylphenidate. Up to 5% of children experience visual hallucinations, behaviors on the medication similar to obsessive compulsive disorder. A variety of physical symptoms refer to text. Possible interference with pituitary functions and impact on growth. Some children report feeling like zombies at prescribed doses. Methylphenidate or Progravil, introduced in 1998 as a wake-promoting agent instead of a stimulant, used as a treatment for narcolepsy and may enhance cognitive endurance for people suffering from fatigue. Stimulates dopamine releases in the brain, can cause shortness of breath, heart palpitations, and chest pain, and electrocardiogram changes. Reduces effectiveness of oral contraceptives. Statera, like other CNS stimulants used for the treatment of ADHD, though not listed as a stimulant, believed to alter norepinephrine release in neurons. Side effects include mild heart rate increase, irritability, mood swings, and aggressive behaviors by children. Can induce seizures and suicidal thinking or acts. CNS stimulants misuse, 1 of 10. Scope of the problem. In the United States, amphetamines are the second most commonly abused illicit compound after marijuana. Upward of 25% of students at some colleges report using Adderall to help with studies. The stereotypical pusher is not typical, but rather physicians with prescription pads are the issue. Methamphetamine, no way to estimate the amount of misuse, but are very popular for such a purpose. Used for working late, studying longer, staying up at parties, and counteractive the sedative effects of alcohol. Some used to seek a feeling of euphoria. Methods of CNS stimulant misuse and their effects. Effects of ephedrine abuse are essentially an exaggeration of the effects of ephedrine when used at normal doses. The most common method of ephedrine abuse is for the individual to ingest over-the-counter ephedrine tablets. Ephedrine abuse can result in impaired judgment, agitation, necrosis of GI tissue, nausea, vomiting, stroke, irritation of cardiac tissue, potentially fatal heart arrhythmias, and heart attacks. Effects of amphetamine when misused. Different drugs can be taken orally, snorted, smoked, or injected. The individual might experience a state of heightened alertness, confidence, and euphoria. The amphetamines and related compounds are popular drugs of abuse on the college campus, especially as students prepare for examination. Kitchen labs is very unstable and explosive, often used for the production of methamphetamine. Consequences of amphetamine misuse. Enhance normal body functions that can be fatal. Brain damage can be destroyed up to 50% of the dopamine-producing neurons. Methamphetamine addicts have significant reduction in the gray matter in their brains. Other identified neurological consequences of methamphetamine abuse include agitation, delirium, and seizures, as well as increased risk of stroke. CNS stimulant misuse. The digestive system. Abuse can result in diarrhea, constipation, nausea, vomiting, and aesthetic colonitis. Methamphetamine abuse is associated with acute abdominal pain and large gastroduodenal ulcers. Meth mouth, significant tooth decay, often leading to the need for tooth extractions. The cardiovascular system, higher risk for myocardial infarction. Long-term methamphetamine use, but especially the abuse of methamphetamine, has been explicitly implicated in the acceleration of plaque development in the coronary arteries of the user, contributing to coronary artery disease for the abuser. Amphetamine abuse can also result in hypertensive episodes, tachycardia, arrhythmias, and sudden cardiac death when abused at high doses. Other consequences of amphetamine misuse can cause ribomyosis, cause of sexual performance both in men and women. High doses misuse increase risk of episodes of potential fatal body hypothermia and liver damage. The addiction potential of amphetamines. Experimental use is not advised as there is no test to determine who will become addicted. Stimulate the brain's reward system may be faster at addicted than cocaine. Amphetamine abstinence syndrome. Withdrawal symptoms including anhedonia, irritability, depression, fatigue, increased need for sleep, sleep disturbance, REM rebound, and poor concentration. Symptoms can last for months after reuse. Methamphetamine. Serious methamphetamine users will crush the pills into a fine powder, then either inhale the powder or inject it into the vein. Those taking to control ADHD usually do not develop signs of addiction. Consequences of misuse, physical addiction, and drug-induced psychosis. CNS stimulants misuse in the Diagnostic and Statistic Manual of Mental Disorders, 5th edition. So this is what they have in the DSM-5 for diagnosis. Stimulant use disorder, stimulant intoxication, stimulant withdrawal over other stimulant-induced disorders, or unspecified stimulant-related disorder. So that's it for this video. Thank you for listening.